Welcome, medical students, to today's lecture on the topic of pulmonary embolism. Pulmonary embolism is a serious condition that occurs when blood clots travel to the pulmonary arteries, blocking blood flow and potentially leading to life-threatening complications. In this comprehensive lecture, we will delve into the intricate details of the pathophysiology, risk factors, clinical presentation, diagnosis, imaging modalities, prognostic tools, treatment options, surgical interventions, long-term complications, and prevention strategies associated with pulmonary embolism. Let us begin our exploration of this fascinating subject by understanding the pathophysiology behind the formation and lodging of blood clots in the pulmonary arteries. In pulmonary embolism, blood clots from the lower extremities travel to the lungs. This occurs due to factors like clotting disorders, reduced mobility, and blood vessel injury. Understanding these mechanisms is important in understanding the disease. In the section on risk factors and predisposing conditions for pulmonary embolism, various factors are examined. These include immobility, pregnancy, cancer, inherited and acquired thrombophilias, which all increase the likelihood of developing a clot in the lungs. Identification of these risk factors is crucial for appropriate prevention strategies. Recognizing the signs and symptoms of pulmonary embolism is crucial for timely diagnosis and management. Dyspnea, the most common symptom, may range from mild to severe and can be associated with pleuritic chest pain, hemoptysis, coughing up blood, or tachypnea. Other manifestations may include tachycardia, hypoxemia, syncope, and signs of right heart strain, such as elevated jugular venous pressure and lower extremity edema. However, it is important to note that these clinical findings are nonspecific and can mimic other respiratory and cardiac conditions, making accurate diagnosis challenging. Therefore, a comprehensive diagnostic approach is necessary. The diagnosis of pulmonary embolism involves a thorough evaluation of the patient's history, physical examination findings, and risk factors. Laboratory tests and imaging studies, such as D-dimer, chest X-ray, computed tomography, pulmonary angiography, CTPA, ventilation perfusion, VQ, scan, and echocardiography, aid in confirming or ruling out a pulmonary embolism. Each modality has its own advantages and limitations, ensuring proper diagnosis. The chest X-ray is often used to rule out other causes and may show secondary findings, while CT scan is the gold standard for diagnosis. Ventilation perfusion scans and echocardiography are alternative imaging options with specific uses. In order to assess the severity and risk stratification of patients with pulmonary embolism, prognostic tools such as the Pulmonary Embolism Severity Index, PESI, and simplified PESI have been developed. These indices consider various clinical, laboratory, and imaging parameters to predict the 30-day mortality risk associated with a pulmonary embolism. Factors such as age, comorbidities, heart rate, blood pressure, oxygen saturation, and the presence of right ventricular dysfunction or elevated biomarkers aid in determining the appropriate management approach. The use of these tools allows for risk stratification and the selection of the most suitable treatment strategy for each individual patient. In the management of stable pulmonary embolism, anticoagulation therapy is the standard approach to prevent clot formation and facilitate clot stabilization. Thrombolytic therapy is reserved for severe cases and aims to actively dissolve the clot, but carries a higher risk of bleeding complications. The choice of treatment depends on various factors. Novel oral anticoagulants, NOACs, also known as direct oral anticoagulants, DOACs, have emerged as alternative therapeutic options for pulmonary embolism management. Unlike traditional anticoagulants, such as warfarin, NOACs possess predictable pharmacokinetics, do not require routine monitoring, and have fewer drug-drug interactions. The NOACs approved for the treatment of pulmonary embolism include rivaroxaban, apixaban, edoxaban, and dabigatran. Their efficacy and safety have been established in large clinical trials, demonstrating non-inferiority to conventional therapy with a similar or reduced risk of bleeding. The use of NOACs has revolutionized the management of pulmonary embolism by providing patients with more convenient and effective oral treatment options. Catheter-based interventions like thrombectomy and catheter-directed thrombolysis are used to remove or dissolve blood clots in the pulmonary arteries. They are typically reserved for high-risk cases and carry their own risks, requiring skilled practitioners. Surgical pulmonary embolectomy is a last resort procedure to remove emboli from the pulmonary arteries. Indications include hemodynamic instability, failed thrombolytic therapy, large clot burden, and no contraindications. Despite risks, it can be life-saving in severe cases. Following a pulmonary embolism, patients may experience various long-term complications and develop a condition known as post-embolic syndrome. Chronic thromboembolic pulmonary hypertension, TEPH, a potentially serious complication, arises when unresolved or recurrent emboli lead to persistent vascular obstruction and pulmonary hypertension. Post-embolic syndrome refers to a collection of symptoms and functional limitations that can persist even after successful treatment of the pulmonary embolism. These symptoms may include dyspnea on exertion, exercise intolerance, fatigue, and impaired quality of life. Recognizing and managing these long-term complications is essential for optimizing patient outcomes and ensuring effective rehabilitation. To prevent recurrent pulmonary embolism, use long-term anticoagulant therapy with warfarin or NOACs. Consider factors like risk factors, thrombophilic conditions, and initial embolism extent. Some high-risk patients may benefit from an inferior vena cava, IVC, filter, but careful patient selection and monitoring are crucial. In summary, pulmonary embolism is a complex condition with various clinical, diagnostic, and therapeutic aspects. Understanding its many facets is crucial for healthcare professionals involved in its care. Thank you for watching.